Hello, everyone. Welcome to AlePsics, the podcast. Just a normal podcast, but more controversial and shorter. Today, we will be talking about the LGBT community during the COVID-19 pandemic. We have a very special guest because he's my friend, almost like a brother, and I'm so thankful that he accepted. So let me introduce you to today's guest. Daniel Alejandro Garcia is part of the LGBT community, and more importantly, he's passionate about discussing all the topics that are not normally brought to the table. So don't doubt that he will be in this space in future episodes. Welcome, Daniel.
Hi, Alexis. Thanks for having me.
Oh, you're so welcome. So, one of our many discussions, but now brought to a podcast. So, I hope we can achieve the 10 minutes goal. So, we have just a little time to discuss on some of the main issues that the LGBT community is struggling with during these hard times. So, let's start the conversation. The first point that I want to bring is love. So, how according to what you know from friends, from people within the LGBT community, how is love during this pandemic? And by that I mean how the way of relating one with others and try to find a couple, another significant, is for people in the LGBT community. Of course, if if you can provide a little bit of a background in comparison with non-LGBT people, that would be great.
That's a really good question. And actually, at the beginning of this pandemic, I think that things were kind of harder because, everyone was afraid of getting the virus and, so they wouldn't go out, they wouldn't hang out with anyone. So it was hard. However, these apps such as Grindr, Tinder, I don't know, people started using them a lot because they were kind of free for a short period of time. And well, the truth is that I don't really know what people used to do. And well, then, 6 months later, more or less, people started, not being afraid anymore of the virus. So they started hanging out a little bit more and from my well among all my friends, people started dating, started having a new relationship with, I don't know. And that's how it happened. And it is hard because not everyone wants to go out. I mean, look at me, I don't want to go out, I'm afraid, and you know why. But I think it's not that hard. And there are illegal meetings and cruising stuff, and I don't need to mention any more things. But yeah, that's it. It's a hard topic.
Yes, and I think that this is just the tip of the iceberg because we have, of course, in here some divisions in regards of what the COVID-19 has represented for some of the people within the community. I have heard, for example, I have your view, and I know that there's a big bunch of people out there from the LGBT community that are very respectful with the norms. So using face mask, social distancing, and but I know there's also this other part because I have heard from some other people that I know within the community that are going out, just as you said, either to illegal meetings or they have met with other friends, not illegally because it is not considered to be a crime, but it is not the most recommended thing. So I'm totally aware of that, and that exposes them, right? And I think we can link this with our next topic because I have heard from some people, just as you were saying, cruising. That is something that just itself can be responsible for a bunch of diseases and infections, right? Because when you're cruising, you don't know who you're having sex with or these practices with. And I have heard from people still doing so during the pandemic times, and that is a problem because when it comes to the physical health, it has been observed that LGBT people do not have social security. and that is a problem for the LGBT community in the sense that leaves all of the people within the community not cover against, yes, this sexually transmitted
Exactly.
infections, but also against COVID itself. So how has been the experience that your LGBTQ friends have had specifically with COVID?
Well, I have this friend, and she was like, she got COVID like 1 month ago, and well, she had this girlfriend, and I mean, they were going out, and then the girlfriend got COVID, and then my friend got COVID, and she was really, I don't know, she really bad. She felt so bad, and she was like that for, I don't know, 1 2 weeks. I don't really know. And well, fortunately, regarding COVID, I mean, it doesn't really matter if you have your IMSS or not. You're going to be assisted, right? And unfortunately, as you mentioned, talking about IHP, for example, HIV, I'm sorry, for example, or any other disease, right? Such as mine. Um, yeah, I mean, it is sometimes hard to get your treatment. I mean, regarding in this case just HIV, it is a little bit hard to get your treatment because, well, the system here is not like really good. I'm not gonna criticize it like a lot, but we know that it's not so good, and sometimes you have to do a lot of things that you shouldn't do. Well, there is this. There is this clinic, Condesa, and sometimes they don't have your medicine, and it's like, what am I gonna do if I mean, what can you do, right? And people have to be like, okay, in groups, like posting, who has this medicine, can you share it with me? Or I mean, this is that something that you shouldn't do. I mean, the government or the health system should provide you with this stuff. And that is about IHP. And well, regarding other things, well, among young people, fortunately, it is not really common that they got, I don't know, any other disease such as, I don't know, cancer, or I don't know.
Yeah,
And well, if people don't work, in like, I don't know how to say it, like formally, normally, I don't
yeah,
know how to say that,
formal jobs.
formally, right? They don't. I'm sorry, they don't get the IMSS. And for example, if you sell things in on the street, or I don't know, you don't get your IMSS. And what do you do if you get a disease? I mean, and it
Yeah,
is a
and
little bit
actually,
worrying.
yes, and we have
Sure, go
seen,
ahead.
sorry for interrupting right there, and we have seen a decrease, well, not a decrease, but actually an increase in unemployment from the LGBT community. So
That's right.
numbers
That's right.
reported March last year, at 31% of unemployed LGBTQ people, and by July it had increased to 40%. So I don't have the current numbers, but I'm pretty sure that it is getting worse and worse.
Exactly. Yeah, I totally agree. I know this data. I mean, and I mean, what can you do if you get cancer, or and you don't have IMSS? Well, fortunately for me, I have had my aims for so many years, and well, I haven't had troubles with that. I mean, with the papers and stuff. I mean,
Yeah,
so well, fortunately
but
for me, but there are other people outside that are not like protected at all. So it's
and we
kind of
know
worrying.
that even if social media sometimes try to tell us a story in which LGBTQ people is fancy people, is pop stars, is bloggers such as perhaps La Divasa or all of these TikTokers that are earning a lot of money. Most of the LGBT community do not have those privileges. So access to healthcare is very rare because some people work, and we have there are some impressive statistics about how many people work in the LGBT community work in the sexual industry. So
Exactly.
that is an industry that is for sure so far not covered with social security. We know also that, for example, performers such as drag queens, dancers, many of these jobs that are normal, and I don't want to stigmatize, but according to statistics, some of the most of the LGBT community have non-formal jobs, and that just as you mentioned, and that leads to not having social security. And of course, when you have any kind of disease, just as you said, when you have COVID, you are still assisted by the social security because it is now all of this part of the support with that sickness. However, we know that, for example, it is very difficult this time to get, and especially last December, in December 2020, when the peak was at its highest. It was very difficult to get oxygen, to get medicine. So that's just, I think that it's unbelievable. And sometimes, and also imagine being uh, uh, taken care of because of that. But then we know the discrimination that the LGBT community have has to face every single day. So imagine that you're being assisted in a hospital in which people are have this macho culture, and then they don't give you the proper care because you are transgender, you are queer. So and they are and they are not willing to treat you as well as with the same quality as they would treat anyone else. And that's also a fact. Which leads me to our last point for today, which is mental health. Something that we have seen and that we also have impressive statistics is that 75% of LGBT people have reported an increase in anxiety and depression compared to only 40, 49, almost 50% of the non-LGBT people. So why do you think this difference happens? Why do you think it is this one fourth more than people who are straight, who are cisgender? What could be the definition for that 25 percent differentiation?
Well, actually, I've thought about this before, and I have a theory. Well, you know that being LGBT means being rejected, and you know, and well, that includes your own family. I mean, if they know that you are gay, if they know you're a lesbian, you know, if they know you are queer or transgender or whatever, you will get rejected. So, well, I think that the family is a very important thing for everyone. So, I mean, how do you feel, or how would a person feel if this person is rejected by their own family? I mean, it's unbelievable. That's unacceptable. I mean, fortunately for me, I didn't go through this, but there are a lot of people outside who have gone through this. And well, this is, I think, I believe that this is why a lot of people, I mean, LGBT people suffer from anxiety and depression because when being rejected, I mean, they feel lonely, they feel that they don't have anyone to trust, they don't have any friends. And yeah, I mean, yeah, that's why I
Yes,
think
and
that,
especially
sure,
exactly,
go
and
ahead.
especially for people. Thank you very much, and sorry for the interruption again. I think that for us, just as you mentioned, we have, and that is part of a complete different discussion that I hope to have you discuss in a future episode. But in centralized places like perhaps Mexico City, there is more open minds to or the people are getting more open-minded about LGBTQ people, and but if you go outside that uh, that environment, it gets a complete different story, right? So If you go to little towns, for example, like the one I am living with, it is a normal stigma for people if they are just if they say that they are lesbians or gays, and apart from that, saying that you're queer or that you are bisexual or that you are pansexual or that you are transsexual, that is a complete different story because that is even um, punished harder. And just as you mentioned, if now you're in a situation in which you have to live every day with your family and they do not accept who you are, that is going to cause a lot of struggle for a lot of people, especially people who have never had support for mental health, right? And I think that that is important to raise awareness that there are many spaces um, nowadays online via phone which you can address for some support, right? At a national level they are for free, and I think that that has to be promoted because
Exactly.
taking care of your mental health, that's really important. We already, prior to the pandemic, we already knew that LGBTQ people were more likely to commit suicide than non-LGBTQ people. So that taken into consideration in these hard times is even worse perhaps. So and it's all related, right? So not being able to hang out with your friends who you normally consider your family instead of your own family, also not having a job that secures that you have an um, periodical income, if you will, it's a way another factor for being stressed. And apart from that, being and living every single day with people that you don't feel secure with, that is another stressor in your life. So, well, for the points that we have discussed today, it has been left in which we have two divisions for people who take care of themselves regarding the COVID-19 measurements that have been given by the government, and some other people in the LGBTQ community that are continuing to have uh, these illegal, well, not so illegal, but not adequate practices like cruising, like still attending meetings, still dating people they don't know through apps, and that took us to the physical health and social security that is really related to the work environment, and that some people fortunately have access to social security, but there are a lot of people that given the work situation for the LGBT community people is not there and needs to be taken into consideration. And all this being taken into consideration as a whole leads to problems in mental health, raising 75% against 50% from non-LGBTQ people. So, anything else that you would like to add to this episode, Daniel?
Yes, yes, yes. You mentioned some places where you can call if you have problems with anxiety or depression. So, well, I would appreciate it. I would appreciate if you could tell me or mention those places or a place maybe for
Yes,
people to call
there
or
is a
to
call
go.
center. Yes, there is a call center at UNAM that is that is free. I cannot recall right now the number, but it will be somewhere here down below in the description of the video. So everyone who feels the need to check on that can call there. Attention is in Spanish, of course, because this is for Mexico region. But I will try to get numbers also for international support. I know there's like this United States suicide line, right? So those are very important scenarios. And me as a psychologist, I can, if anybody has a question or something who's listening to it, I can totally share with them more information about the other spaces. But yes, definitely that is really important to share with people.
Yes,
Thank you again.
thank you very much.
Thank you for being here. Thank you for accepting the invitation and booking time for this space.
Thank you.
Well, that's the end of this episode. And don't forget to follow Daniel on his Instagram as Danostasio, right?
Yes, it is.
Okay. So thank you, everyone. Just as they say, Don't forget to like, subscribe, comment, share with your friends, with those when you think they might appreciate this content. And that would be it for today. So thank you.
Thank you.